Good morning and welcome to the Monday morning message for Chapter 16, Quality Improvement and Risk Management. Very important topic, and actually the way I typically present this to students is that risk management is something that we all must be aware of. And of course, quality improvement as well. And there's a lot of different ways to kind of look at this. So we'll take a look at how it might apply in particular in a doctor's office or a hospital. But the majority of businesses across the country really take this very seriously. What risk management and quality improvement does is it improves the experience for the customer, or in our case, for the patient. And risk management, by paying very close attention to the things that can cause us to potentially do harm to a patient, or could potentially lead to litigation at some point in the future, or loss of business or bad reputation. Those things go into risk management, and we're all a part of that. Just our presentation alone to patients as being, professionals and experts in our field, that is actually a part of risk management, in my opinion, just the perception that patients have about us. So when we kind of look at our PowerPoint or look at our text, I kind of like this particular slide that says quality improvement programs, and it looks at, in particular, larger corporations usually have some type of a quality improvement program. Now, that may be different in a smaller private practice per se, but larger organizations like hospitals typically will have a quality improvement program. And this is where we really try to implement solutions that could improve patient satisfaction. Patient satisfaction is actually a big thing in the hospitals. Patients oftentimes are given surveys when they're discharged, and those surveys will guide a hospital into looking at potential problem areas or areas where things need to be improved. And that could be from the delivery of the healthcare all the way down to just the meals potentially, or the food that is delivered to a patient room. There are obviously areas that we can improve upon the patient experience with that. So again, larger organizations typically will have some kind of a quality improvement program, and maybe a director or the head of that particular area. In smaller practices, it doesn't really work that way. We usually don't have the resources to have an actual distinct program, but we're always looking at things to improve the experience for our patients. So, for example, in my previous practices, we've looked at things like same-day appointments. Most of you have gone to doctors or tried to make appointments with doctors in smaller groups, like a specialist, where they say, "Oh, we don't have an appointment for 6 or 7 weeks." Well, is that something that a patient will keep in mind in maybe visiting that provider or making an appointment in the future, or making a follow-up appointment? If it takes so long to get in with somebody, can we improve that experience? So in previous practices that I've worked in where we've had this issue, we've actually carved out a block of time every day. So an example of that would be in a practice I worked at, where between 11 and 12 every day, we would leave that 1 hour block of time open every day. And that 1 hour block could not be scheduled until that day. So that would ensure that for patients that had acute issues, like, I woke up with a sore throat, or I woke up with a headache, or, I've had diarrhea all day, they could make an appointment and get in that day for a very acute visit, and that improved the satisfaction of our patients who were told previously that, hey, it would be 6 weeks before we could get you in. Well, if you had diarrhea, we would hope that diarrhea would go away within the next 6 weeks. And if it didn't, that you would seek care someplace else. But from a business perspective, we don't want patients to go someplace else. We want them to continue to come and see us. So that's a quality improvement issue. So, patient wait times, So that's an example of that, right? Could we improve the patient experience with new equipment or different equipment? And that leads into, cost. Is it cost effective to do that to improve the patient experience? Okay. I like this one, possible issues for quality improvement review, like remodeling the office, how outdated is, and this is something we actually do take seriously, is looking at how outdated is the atmosphere that we're working in. Do we need to update wallpaper, paint? Is the carpet old and dingy? Does that need to be replaced? A lot of us will build that into a lease if we're leasing space, that the carpet is changed, or new flooring is put in every 5 years or 6 years or 3 years, whatever the case is. We try to build that into a potential lease contract. Same thing with painting the walls. If that's something that falls under our building management, can we get a time frame for when we get repainted or re-wallpapered walls? Staffing, are we short staffed? Do we need additional staff? Can we build that into the budget? These are things that we look at for quality improvement. Of course, avoiding patient injuries. We look at things very crucial to injuries, such as our waiting rooms or our reception areas. A good example of that, I had this happen in a practice I worked in, where we had in our reception area, we had a row of seats, of 3 seats that were connected to each other. And those seats were not bolted into the floor. So this is a twofold. This is a patient injury and risk management potential problem, right? So what ended up happening was somebody who was not a patient of ours but had driven a patient of ours down to the office was going to wait for them in our reception area, and that patient unfortunately was very large. They were morbidly obese. And instead of sitting to distribute weight evenly, the patient or the person didn't think about this, but a patient that size, for weight distribution, would have been better for them to sit in the center chair of the 3. Unfortunately, they sat on one of the end seats, and because it wasn't bolted in the floor and nobody was sitting in the middle seat or the other end, the 3-seat structure lifted when he sat down, and he fell over and he hit his head on the floor. Unfortunately, we had to pay for a CT scan to make sure that he was okay, and he wasn't our patient. But to try to avoid a problem or a legal issue, we needed to take care of this person as if they were a patient in our practice. And that taught us a valuable lesson. It hadn't happened in 15 years, but that one incident that we didn't even foresee caused us to have to get rid of all of those chair assemblies and get individual seating, and get seating that was fairly low to the ground, in order to avoid this from happening again. So that's an example of how things can happen. And you think we felt we had a pretty good reception area set up fairly well. And this unfortunate incident happened and caused us to have to expend, money to change the whole setup of that reception area so that we could avoid that problem in the future. So that was a good example of something that actually happened to me. So I like this one, ways to have a good patient partnership relationship. Listen to patients' questions, listen to their concerns. If they bring up issues that are potential, either safety issues, risk management issues, or just quality improvement, quality of their experience in the office, we need to listen to that. Okay, learn to recognize body language, right? Body language is very important, in particular from a clinician standpoint, or a nurse or a medical assistant. We get some fairly good training about how to read patients' body language when we're interviewing patients, but that's also something to pay attention to in our reception areas, possibly. Try to anticipate patient questions so you're not caught off guard. That's a good one, okay? And provide answers to commonly asked questions. Sometimes we put together kind of a question and answer manual so that we can have that available even at the front desk to be able to answer questions quickly and appropriately. Okay. Use touch appropriately to show concern. That's highly important, but also needs to be done in a way that we're not violating somebody's personal space, that type of thing. So that one's can be a little bit tricky. Okay. Speak in the patient's native tongue when possible. Patients that don't speak English, if we have somebody in the practice that can speak their native language, that's wonderful. If not, it's still important to read body language and to really actively listen to that patient and what they're trying to say. Okay, respect patients' decisions. This is all a part of providing that quality of care. Okay, maintain the patient's confidence. Right, very important stuff. So a lot of things there as far as quality improvement. A lot of it really is that interpersonal connection that we build with the patient will improve those relationships. So it's not just about providing services or having equipment. Okay. When we talk about things like risk management, what are some risk management issues? Well, I kind of like this one. As a medical assistant professor, I teach injections. I teach our MA students how to give injections and give them appropriately. One of the things that we talk about, and it's kind of funny, this slide talks about 5 rights of medication administration. And that's for injections or for oral meds or for giving things even intravenously. You'll find differences in this. Some people call it the 5 rights. Other people have the 6 rights, and all the way up to, I believe, 8 rights is what I've seen recently. These are kind of like guidelines for us to ensure safety. So it's about risk management. So when we talk about these rights, right patient, do I have the right patient? The right route would be, am I giving this in the right place? If it's oral and they need to swallow it, if it's sublingual and it needs to be placed under the tongue, did I direct the patient to do that? If it's an injectable, is it the right route? Meaning, is it intramuscular? Is it subcutaneous, injected into basically their fat tissue? Or is it intradermally under the dermis? Is it deep IM that might require a dorsal gluteal injection or a ventrogluteal injection? Right dose. Am I giving the right dose? Am I doing this at the right time? Is it a first morning or late in the day or at bedtime? That would be important. The right medication. We throw in things like the right documentation. Part of risk management is making sure that we document. If I haven't said this before, I'm going to say it again. One of the cardinal rules about healthcare is if it wasn't documented, it never happened. So right documentation is highly critical in maintaining avoiding having some potential risk or danger to the patient. So right documentation. Documentation also provides us a legal document, right? When we document in the chart, it's a legal document. It protects us in a court of law against possible lawsuits or legal action. So the right documentation is critical. Using things like an informed consent. Informed consent is when we write things down and we detail out to a patient exactly what we're doing, what the pros and the cons are to what we're doing, what the risks and benefits are to what we're doing. That's a form of risk management, okay? So communicating things like adverse reactions. That would be adverse events that could happen, side effects of taking a medication or having this injection given to them. That's all a part of risk management. Providing paperwork on something that we do in the doctor's office when we give a immunization to somebody. We provide them with what's called a VIS, a vaccine information statement. So what that is, and that's provided to us from the CDC, and we can get that from the CDC's website. And I'm going to actually go ahead and show you that. So that VIS gives the patient information about the injection that they just received or they're going to receive. Okay, so if I pull up here for you a vaccine information statement, I'll show you exactly what those look like on the CDC's website. And the CDC's website, this is a website that I use very, very frequently. I use this all the time. I direct patients here. I look for information on it. So cdc.gov.gov, very important. I think it's a wonderful resource for patients and for providers, whether that's nurses, doctors, PAs, nurse practitioners, and medical assistants. I urge and encourage my medical assistants to use the cdc.gov website frequently for gathering information and gathering patient information as well. All right, so the vaccine information statement, so this is what it would look like. We can go ahead and I'm going to pull up for you some of the VISs. So let's look at this. I don't know why I'm struggling with that. Oh, this one's actually good. Current VIS editions. This is important that we stay up to date and have the most current revisions of a VIS. So current VISs, this says download all. Let's just take a look at one, okay? So we'll take a look at, this is an interim VIS. So let's take a look at that. So this is what we would give a patient if we had were giving them a hepatitis B, or have already given them one where they agreed to take it, but we wanted to give them information. It talks about, why you should get vaccinated, what this looks like. A hepatitis B vaccine is given in 3 doses typically. Talks about what people are at higher risk of contracting hepatitis B, what are the risks of the vaccine, what risks or reactions or adverse effects could you have. If there's a serious problem, what to do, where you can learn more about this vaccine. So that's actually useful information for a patient. And this is a part of risk management and also that quality improvement, right? It deals with the quality of care that we're providing if we can give this to a patient so that they're as informed and educated as possible about what we've given them today. All right. So I think that kind of is risk management and quality improvement in a nutshell. When we look at one other item, right, using protective equipment, us as providers of healthcare services, we should be wearing things like gloves, obviously, goggles and masks when there's a risk of spray potential. Gowns, lab coats, that type of stuff to try to protect us. Leather shoes, closed-toed shoes, that's all risk management. Goes as far as even things like, in particular in the hospital level, no acrylic fingernails, because that's a breeding ground for bacteria. Hoop earrings is usually a no-no in all facilities, just one single stud. Because hoop earrings, you can get your stethoscope caught in it. Children could pull on them and rip your earrings out. That's just trying to keep the employee safe, and that's also part of risk management, right? So a lot of information there. Read your chapter, please. If you have any questions, comments, concerns, or rude remarks, as always, email me and I will get back to you as quickly as possible. So until next week, enjoy your week, and I will see you again for another installment of the Monday Morning Message.
But when things fall into place, superposition, in any universe, you are my dark star. I won't